Doctors of Reddit, what is your most awkward experience when dealing with members of the opposite sex? Not safe for work. We are taught to explain to patients exactly what we are doing, as we are doing it. Delicate wording becomes important during female pelvic exams. Instead of "okay, I am going to place the speculum inside now, so you'll just feel some warm pressure," my buddy ended up saying, "Okay, I'm coming inside you now." The female patient responds, "No thanks, I already have 3 children. So I'm a little bit late, but I have something. I'm not a doctor, but a pharmacy technician. About a year ago, a young woman comes in very upset and turns in a prescription for a bunch of anti-anxiety and anti-psychosis medications. All is going well until I realize we are out of one of them and I have to tell her I have to order it for the next day. She was okay with it at first, but then I see tears building. I ask if she is okay and says yes, so I continue typing up the prescriptions. I want to say there was about 8 or 9. Next thing I know, she begins crying. She starts telling me that she was just released from a psych ward and she had tried to kill herself a couple weeks back. She rolled up her sleeves and her arms were covered in deep cuts. She began to ask me if I thought she would ever get re-accepted to nursing school, because apparently they kick you out after getting admitted to a hospital for psychological symptoms. I had no idea what to tell her except that I hoped she got in, and that if she worked hard they should give her a chance. I know this all may sound shallow, but I was not prepared for this. Nothing in pharmacy tech training told me how to react. So this was definitely my most awkward moment with the opposite sex. My classmate and I were at a free clinic performing our first ever pelvic exams on standardized patients. Classmate is a big woman pillager of a man and gets to go first. He proceeds to insert his fingers to palpate for the bimanual exam. Our poor standardized patient shrieks right away. She promptly states that for all women's sake, he's gonna need to use one finger for those procedures from now on. Not a doctor, but a nurse. Trying to insert a catheter on a guy with a micropenis inverted peanuts. One of my friends was getting a physical for a high school sport, I believe, and when it came time for them to check his gonads, the doctor says cough, but apparently my friend thought he said hop. So here my friend is standing there. The doctor has my friend's boys in hand and my friend hops. Said it was the most embarrassing moment of his life. Doctor here. Recently walked in on a new mother in a sitz bath with 2 breasts pumps gulping away at her all the while her husband grins from ear to ear as I worked her up for a pubic bone injury. The newborn could sense my embarrassment. My perspective may be off the scope of the thread since I'm a veterinarian, not an MD. In my experience, people who do not want to neuter their male dogs are always males. Having a frank discussion about the benefits of neutering with someone who is emotionally attached to their dog's testicles is pretty awkward. Not me, but a fellow classmate in medical school. We have mock exams, and various people will sign up to be patients. They get paid a decent amount. So he went in the mock exam room and started the basic history and physical on the fairly attractive female. Did this and that pretty standard stuff. Grabbed and a tongue depressor and had her open her mouth. Then, nothing. He did it again and said with bewilderment, "That is weird, you do not have a gag reflex." She smiled and gave him a coy wink. He about lost it and couldn't finish. He walks out and finds the preceptor who monitors the exam about rolling on the floor laughing. As for me, I never really had an overly awkward experience other than maybe knowing someone, which can make certain exams a little awkward. I was the chaperoning nurse. Young doc. First week in OB and was seeing early pregnancy PT in Tridge. Docs usually say I'm going to put my hand on your VJ now, or you will feel the speculum on your lips labia. He was rattled and so nervous he conflagrated them as I'm going to put my lips on your VJ now. The patient and I roared with laughter for a second before we controlled ourselves. He shakily kept his dignity and kept right on going like nothing happened. He never referred to it again for the 4 years he was there. Not a doctor. Student rad tech. Had a patient for a regular chest x-ray series, but she was coughing up sputum. I asked her if she wanted a tissue to cough it up into and she said she didn't spit. She was a swallower and winked at me. I'm 19. She was 98. Use liquid nitrogen to freeze genital warts off of a 20-something-year-old girl. After she touched her genital warts with her hands to show me where they were, I applied cryotherapy and left the room for a moment so she could get dressed. When I got back she proceeded to grab my hand and shake it. After touching all of her warts, without washing her hands. Patient here. I was in a small town where my parents used to live and I had to see a gynecologist. I was worried that I may have had a tampon stuck in my VJ. PSA. That's not physically possible, but I didn't know that at the time. Unfortunately, the only doctor I could see was a friend of my parents. After thoroughly probing and peeking he informed me that there was nothing wrong. In fact, your VJ is, for lack of a better word, gorgeous. I've never been so embarrassed. I had to babysit his kids that weekend. My pediatrician used to substitute this old male doctor sometimes without notifying anyone. It was almost always the days I was coming in for my sports physical. That feel when you're going to get your balls touched by a lady doctor in your early teens and then seeing an old man snapping latex gloves on. I had one patient who had made her desire for me very public, but since I treated her entire family, I decided not to kick her out and continue to remain professional. In the midst of a bipolar mania, she kept complaining of female issues. During her pelvic exam, I happened to look up and I saw a gigantic smile on her face. After the exam, in the hallway in front of a few residents, she said if you weren't my doctor, I'd frick your brains out. Perhaps I should have mentioned this earlier, but she was the only woman I've ever met who is a 0 out of 10. She's the only patient who made me question my heterosexuality. Somewhat related, but from a patient's perspective. When I was in nursing school I went to my school's student health center for a gyno appointment. The doctor asked me if it was alright if a medical student was present. I said that was fine. She then specifies the student was male and asks me if that was still okay. I wasn't totally comfortable with that, but as a nursing student I knew how much it sucks when a patient refuses you, so I said yes. Lo and behold it was an incredibly attractive med student from my school who I bumped into all the time, and he saw the inside of my VJ. I never could look him in the eye after that. When I was 16, I sometimes got dizzy if I stood up really fast. I'm pretty sure this is relatively normal, but my mum thought something was wrong with me. So, she took me to the doctor, and he wanted to check for testicular cancer. I had a worried look on my face, because I didn't want an old Asian man feeling my nuts. The doctor saw my face and thought it might console me if he spoke teenager. He said in his Asian accent, "I'm gonna feel up your balls." I felt pretty awkward after that. My doctor once said, "You're so thin. It's very easy to palpate your organs." Then he felt my spine from the front. It was awkward. ER in Brazil. 20-year-old woman receives a knife cut in the chest. Slides both of them across. Superficial injury, but it needed sticks. No plastic surgeon. Sus ER in Brazil. Started the procedure. You like them, don't you? If you make them pretty again you can play with them all you want. The nurse was mortified. This would go on for 45 minutes. As soon as the next doctor on schedule arrived I was endined the sticks and referred her to the other doctor and noped out of there. English is not my primary language. Sorry for any mistake. I will preface by saying that the word opposite doesn't quite fit here. Last year I had a transgender patient, FTM, who had completed their transition hormones and mastectomy only, for now, and had been living as a man for about a year or so. One day he called me and asked if he could have a blood test for HPV. I told him that the only test for HPV was a cervical swab. To be thorough, since he still had a uterus, we could do a pap smear with a swab to check for HPV. He agreed. It was a difficult and painful exam. He'd never borne children while a woman, and the testosterone he was taking made his VJL canal smaller, drier. Even with the smallest sized speculum, it was very uncomfortable for him to complete the exam. It was awkward for me, not just because of his pain, but because he had been content with his transition and was living happily as a man, and then I had to give him an intrusive, painful reminder that he used to be a woman. It felt like a violation to me, much more so than the usual pap rectal exam, like I was somehow going against the transition he'd worked so hard for. Of course, to top it all off, the lab lost the HPV sample. We'll have to repeat it again sometime this year. Thankfully, at least he has an amazing attitude despite this. I still feel awful about the whole thing. Patient side of the story. I got a positive on a STD test, so to take the secondary test to make sure, I went to public health center located near me. The blood drawer person was extremely cute, so when she drew my blood I was striking up a conversation, just to be friendly. She says, "You're awfully cheerful for a person that doesn't know if you have a STD or not." I tell her, "Well, you'll let me know if I do." She gave me a smile and left. When someone came back, I shoot you not, I was facing the other way and said something charming flirty, only to turn around face to face with an old lady doctor. She even had a sense of humor and said, "You can call me when you know you're clean." She was the kind of woman you can tell that used to be pretty about 20-30 years ago, but old age took its toll. I got embarrassed, asked for when to come back for results, and left. Week later I go back, see the same old lady doctor, and tells me I'm clean. I left before any awkwardness bubbled up.